Hello everyone, I'm Dr. Sonal Agrawal. I'm a pediatrician and an allergy asthma specialist. I've been a pediatrician for over 20 years now, and I thought I will share a few tips with you that I give to parents of newborn toddlers and infants. This video we are going to talk about the newborn period, and I call it the sounds of the newborn. Our little bundle of joys are actually a very noisy bunch. Now, a lot of parents are concerned that the infant is not sleeping well and is in some trouble because they're groaning all through the night. Now, it's very common for babies to squirm, squeak, groan, moan, and even grunt at night. And the thought process is that most likely the kids have been confined to a small place in mom's womb. And when they come out, it does stimulate their nervous system. And sometimes that's why these kind of squirming and a little bit of restlessness can happen. But again, that's completely normal. Now let's talk about other noises that the babies make. Now babies usually are obligate nasal breathers. That means they breathe only through their noses. And on top of that, they have small nasal cavities, and they make a lot more mucus. So no wonder when they're breathing through their noses, they're going to make a lot more noise, a lot more that sounds like a snort or like a gurgle. And that accentuates when it is cold or when it is dry. So in that case, I usually tell the parents that as long as the baby is feeding well, sleeping well, developing well, gaining weight, we're not worried about it, because my aim is to treat the baby and not treat the symptoms or the test. But if you feel that the baby is having a little hard time to breathe, you can always use some saline drops. You can always use a humidifier. And if you feel that's not enough, please get in touch with your pediatrician. Let's talk about hiccups. Babies tend to hiccup very often, and sometimes it can go on from minutes to even 30 minutes. And this is again completely normal, because the babies do have more gas and their nervous system is growing, and that's why these hiccups could be happening. The other thing that sometimes, especially the first time parents worry about the sneezing of the baby, and they think the baby has a cold, and that's not the case. The babies will sneeze to clear out their noses. Babies and spit up, that's a very common thing. Now, the baby's esophagus or the food pipe is a lot like us, but does miss a little bit of the strength that we have, because at the end of a food pipe we have like a valve that makes sure that whatever is in the stomach stays there and doesn't come up. But for babies, that's a little loose, and that's why things come out very easy. So babies can be spitting very often. Some babies spit several times a day, and some babies don't spit at all, and this is all completely normal. As long as they're happy, they're feeding, and they're playful, gaining weight, we don't worry about the spit ups. But if you feel that the baby is unhappy in between feeds, unhappy with the spit up, and sometimes groaning and sometimes arching, then this is something that you need to talk with your pediatrician. Babies also vomit, and a lot of vomit can come out from their mouth and noses, which is again completely normal. But there are certain vomits that we're not happy about as pediatricians. So if the vomit is forceful and it's kind of landing away from the body of the baby, and happens quite often, then pediatricians need to be notified about it. I hope this answers a lot of your questions and queries. For other questions regarding newborns, infants and toddlers, please see my other videos. Thank you.